Steroids play a very important role medically, and especially for people who have autoimmune disorders, severe allergies, and even in cancer treatment. They're very important, especially when people have too much inflammation. A little bit of inflammation is good, but too much can cause a range of conditions. So let's start with what steroids actually are. They're organic compounds, and they're unique because they have this 4-ring carbon structure, and their structure helps with their function. They're widely used in medical treatments for their effectiveness. The way that steroids actually work is that they can modulate our immune response. So they imitate natural hormones in our body, and by doing this, they can, in essence, influence inflammation. Depending on the type and use, they can reduce inflammation, they can suppress the immune system, or even stimulate tissue growth. And these are important when people are having too much of an immune system on. There's 2 main types of steroids used in medicine. There's corticosteroids, which are produced in our adrenal cortex. That's a layer in our adrenal glands, which is somewhere above your kidneys. These steroids are important in managing inflammation, immune responses, and how our body deals with stress. Another type of steroid is called anabolic androgenic steroids, and these are synthetic versions of testosterone used to promote muscle growth and repair, especially in conditions that cause a lot of muscle wasting. Steroids are quite unique in that they can treat allergies and common conditions like asthma, autoimmune diseases like rheumatoid arthritis, and they're important because they reduce chronic long-term inflammation, especially when someone is having too much inflammation, like too much eczema, that too much inflammation, or digestive issues like inflammatory bowel diseases. Steroids stand out because of their anti-inflammatory properties. During chemotherapy, steroids have an important role. They help manage the effects of nausea and also help with patients' appetite and energy. They're also used to control inflammation and allergic reactions to chemotherapy drugs. It's important to note that too much steroids long-term can lead to weakened bones, elevated blood pressure, increased risk of infections, and even mood changes. And remember, the reason that this happens is when we get hurt in general, or we get sick or anything, our body does inflammation, and inflammation in general is a good thing. It's our body's immune system trying to keep disease under control. Too much inflammation can cause pain, can cause discomfort, can cause difficulty breathing. So sometimes patients are given steroids to calm down this inflammation. So think if you give this too much, it can also have risks. So it's always a balanced approach with how much steroids you give, with the pros and cons.